So all of us on the stage are providers in some way. What do you wish mental health providers better understood about culturally responsive care?
I wish they would understand more that there's the things that can create the conditions for mental health issues in a group of people, a society, or whatever. They're not obviously just individual. They're oftentimes products of like a lot of sickness in society as a whole, and problems in society as a whole. And so, for example, we had a member, one of our members last year, who we were helping with housing issues in Alexandria, and he was very housing insecure. Unfortunately, there wasn't as much, we couldn't help with the housing insecure, and then they committed suicide, and they didn't want to lose their home. And so this is an example of like these social issues of housing and how they directly connect into the person's mental health and their community. And so for me, I think mental health care providers need to be more present and be more present and be champions in these social issues that are creating this mass mental health crisis that we're dealing with across this country.
I think as providers, something that always sticks out to me, since I'm a case manager, I work with families, is to ask and understand the family dynamics of each individual. Each individual's family dynamic can be different from another individual's family dynamic, as well as the family dynamic from culture to culture is very different. So my advice would be to understand, ask about everybody's family dynamic.
Similarly, something that just came to mind for me is that sometimes I feel like when you seek mental health and then your background, your culture, they don't always align. I feel like it's common in therapy to be told to set boundaries and things like that, but if you are familiar with the Latino household, you can't say no to your parents, or you can't just disagree with them. So I think just being mindful and aware of that, and that sometimes they just butt heads, and not all practices help everybody, and that they're not one size fits all.
More understanding about having the language barrier. Whenever I attend a conference, I share this story. When I talk with the county staff about the language service line, they told me, we do have excellent language access line. But then I told them, when actually majority of my clients cannot use your language access support line, because when they dial to, for example, 311 in Montgomery County, Maryland, they will start speaking in English to introduce the number of the other language, right? So press 1 English, press 2 Spanish, all other language, press 3. They cannot understand that explanation. So having language barrier is a fear. So more understanding having difficulties having language barrier, I would like to recast that.
+1.
I think many health professionals know this, but I hope that they remember that by the time someone gets to them to ask for help, how courageous and how brave they were to get there, and that they know that they get one shot to really welcome them into the space and to let them know that they're so courageous for asking for help. Because if we forget, you can change somebody's entire outcome.